Go.
I am the nurse opening the camera and light cord sterilely for the tech to grab. What you'll do first is break the tape on each side. You will first grab this tab, go away from yourself. Next tab to your left, to your right. Only grab this tab and pull towards yourself. After that, your tech will verify the indicator and take off of the field and put it on the sterile field. Your instrument tray will have a lock on each side. When you pop the sides right here, it will break the lock. If you keep your hands over it, it'll prevent this from flying onto the sterile field. You'll pop it, take off the lock, lift up and toward yourself the lid. Okay, this is the sterile back table that the techs are scrubbed in on, and I will be acting as the nurse opening the cysto tubing onto the back field. From the corner, you will peel open and flip onto the field and back.
Go ahead.
Okay. To start your stores tower, you're going to unwind your power cord, plug it in, and your main power source turn on will be right here. As it's powering on, you want to make sure this box right here is turned on with the green light, as well as this bottom one right here, making sure it says 100% and that it's ready to turn on. Your screen will load and it'll be a main menu when it's ready. This is the main screen that will pop up when it's ready to go. So I am the surgical tech and this is my sterile field. We have already on it the camera and light source and our cysto tubing, and we're gonna start from grabbing our cysto tray from off the field. So over on the tray, you'll make sure that the chemical indicator is changed. You will grab by the two handles here, lift and pull away. This way. By taking off the top, break those off, and this can go wherever you're comfortable or off the field. We start off with two different cameras. We have a 70-degree and we also have a 30-degree right here. We're gonna start with the 30-degree. Just know that if the doctor ever asks for a 70, you would just switch it with that. Taking off that layer, we have 3 different color-coded cystos. They're all gonna be different Frenches and they match with the color on each one. We'll go ahead and just go with the 20 French, which is the red. So you'll grab your sheath, your obturator. You have a single and a double bridge. For this case, we can just use the single bridge. Single right here. That one shows a double. And because of our light source, we are going to go to the accessories right here. And we are going to grab one of these guys, which is an adapter. This is what your back table will look like with all the supplies and instrumentation that you'll need. You'll have your cysto tubing, light cord, camera cord, 30-degree lens, light cord adapter, single port bridge, and a 20 French sheath. To assemble your cystoscope, you will start with your 20 French sheath and your single port bridge. Start by connecting and using your thumb to twist the locking mechanism to lock. Give it a tug to make sure everything is secure and close each of the ports. Next, use your light adapter to twist on to your lens. With your 30-degree lens, you will insert it to your cysto. Using the thumb mechanism, you will lock and give it a tug to ensure it's set. Next, you will grab this end of the light cord where it twists freely and twist on to your lens. You will notice that the cord will still spin, but the mechanism here is locked in place. For your camera, there are 2 thumb pieces here. You will twist, place, and then release. Give it a tug to make sure it is not loose at all. If you do feel any loose, that means it is not sitting in the camera, and you will need to twist, remove, and try to reseat again. This is how your cysto should look, so your doctor is ready to start. To attach your cysto tubing, you will break the bands. Remove. This end will attach to either sides right here. Either port is fine. You will wiggle on. And make sure it's nice and secure on there. You can then open and close the port for the doctor to prime. Once your cysto tubing is attached, you will pass off the other end to your nurse.
You will pull off your red tab and spike your 3,000 bag of normal saline.
After your saline bag is spiked, you will pass off your camera and your light cord to your nurse.
You will take your light source and your camera cable, connect camera. For your light cord, you are gonna insert into this top plug, give it a good jab, and turn to lock in place. Then, for the light source to turn on, you are gonna take it off standby. Go ahead.
Once everything is attached, you have your cysto tubing, light source, and camera cord. To prime your tubing, you will open the port until water is running smoothly. At this point, your doctor is ready to use it and they have control over the flow of water.